skies. Let it resound loud as the rolling sea.
You're listening to the Tom Ficklin Show on WNHHLP 103.5 FM, your home for community radio.
Good morning, everyone. Good morning and good morning. Today's show, as you may or may not know, this month is Black History Month, but actually Black History is 24/7, 365. But we conclude this semi-official month with a Black health and wellness focus. And it's just not generic. It's really specific in terms of just not a history or her story of Black health and wellness, but how activists and abolitionists and concerned citizens, concerned clergy, and concerned people understand that this quest for body, mind, spirit integration is a 24/7, 365 endeavor. So again, this year's theme for Black History Month is Black health and wellness. And we're going to look at, for the next 45 minutes or so, past failures of the healthcare system. We can't have blind eyes. We got to keep our eyes open. We got to stay awake, as some people have said. But we're going to look at the past failures of the healthcare system and its inability to adequately serve the African American community, and the tenacity, the courage, the foresight, the commitment of Black scholars and medical practitioners that you're going to hear from, and spiritual practitioners, to overcome these obstacles in the past. This is indeed a special show, and we're going to celebrate the achievements, in particular, of the Yale cultural ambassadors on this continuum, this journey, this saga of Black history and medical innovations. Our guests are Reverend Dr. Leroy O. Perry Jr. Reverend Perry is a pastor of St. Stephen's AME Zion Church in Branford, Connecticut, and he's a cultural ambassador to the Yale Clinical Research Program. Reverend Elvin Clayton, pastor of Walters Memorial AME Zion Church and cultural ambassador to the Yale Clinical Research Program. Reverend Clayton is located in Bridgeport, Connecticut. Reverend Robin Anderson, pastor of Blackwell AME Zion Church and also a cultural ambassador to the Yale Clinical Research Program. Reverend Anderson is located in the Middletown, Connecticut area. And Reverend Eldrin Morrison, formerly here in New Haven, but he's found still a home in Smyrna, Georgia. Reverend Eldrin Morrison is pastor of Shaw Temple AME Zion Church. Currently, Reverend Morrison, I know that your quest continues, so who knows where you might be next time I have you on the show. But the moment you're in Smyrna, Georgia, and a cultural ambassador to the Yale Clinical Research Program. And Ray Anderson. Ray, I know you're not a member of the clergy, but Reverend Perry and others, but you're a member of St. Stephen's AME Church. And when that collection plate comes around, I realize you pay homage to Reverend Perry. So there would be none of these ministers would be on the show if it wasn't for people such as yourself that are committed. You may not wear the collar, but you wear it in your mind in terms of the spiritual uplift. So Ray is a member of St. Stephen's AME Zion Church, but also a cultural ambassador for the Yale Clinical Research Program. Let's jump in. I mean, we talked about some things that we want to discuss for these next 40 or so minutes, and this first question might take up that total time, and if so, so be it. But this year's theme, as mentioned, is Black health and wellness. So what does Black health and wellness mean to you, and how has it impacted your work as cultural ambassadors? Who would like to jump in first? I could point out some names, but I'd rather be.
Tom, I can just kind of jump in and just say that I think it's so very important, this theme this year for people of color in this country, coming through, at least at this point in this pandemic, hopefully seeing the worst of it behind us. It is, I guess this theme has really hit home to me because it's not just about your physical health, but really about your mental, your spiritual, your psychological health. And people of color, especially Black folk in this country, have unfortunately suffered so long with poor health, poor wellness, no wellness at all, until we are years behind, even because of this pandemic. And we're seeing the outcomes, the suicide rates, the just the poor health itself, mental health as well as physical health coming through this pandemic.
Tom, let me just add on to what Reverend Morrison was saying, speaking of the health of our Black brothers and sisters. When you look at some of the statistics, there are 19% of adults over 18 have fair or poor health.
Yeah.
With all the advertisement about smoking, there's still 19% of our men that still smoke, and 12% of our women still smoking regular cigarettes. When you obesity, our men and our women. I don't want to get into numbers. I don't want nobody to shut the TV off or the computer off, but this is a huge problem that we need to look at. And because of obesity, it leads into hypertension. So we have issues across the board today. And it just doesn't start with our adults. It starts at birth. Well, we have more stillbirths than anyone. So we have a lot of work to do in this area.
Yeah. If I was to think about also, as we think about health and wellness and some of the things, it would be access. As we know that, during the pandemic, but has always existed, and even 100 years ago when we had the Spanish flu, some of the same issues that we're seeing now in terms of the disparities that exist among, African Americans and people of color, we have not, the needle has not moved but so far. And I do think that one of the things that the pandemic did was that it just kind of took the covers off of what we already know that exists in our community in terms of the health disparities and the diseases that we continue to die from, and that we die faster than our white counterparts because we don't have access to things that would keep us healthy, environmental kinds of things, housing and those kinds of things, access to medical care and persons, access to medical care or medical insurance, has also existed, or even with medical insurance, not knowing what we have access to. And then as it relates to, our mental health, really not even looking at that or addressing that, and, not really knowing how to address it, also. I think one of the greatest things to me in terms of the Cultural Ambassador Program is that, we have access to information that we're able to share with the community. We're trusted messengers and people that are at the forefront that are seeking to infiltrate the healthcare system to make them aware of the disparities and, those interventions that could take place in order to help them, but also allowing them to know how to gain access and to open up that door for them to have access. So many more things I could talk about, but I just wanted to share that.
Well, you're going to have time, so we're going to give everybody their Reverend Perry.
I think, Reverend Anderson, you've hit it on the nail in so many ways. In terms of there is a systemic component to our health in America, and it's and I don't want to blame the healthcare system on it, even though they must take their responsibility. But I also think that it has been because of this systemic breakdown that has helped to foster a breakdown in the Black family. For example, our men are in jail; they can't get jobs, they can't get housing. I remember, and when we were coming up as children, our parents took charge of our health. I mean, we didn't ask whether or not we got a measles shot or a mumps shot or a flu shot. we didn't, we depended on them for what they considered was the right foods to eat. And they know when to pull us from the table, and they knew when to send us outside to play. And it just seems that is so missing now, and it's a critical part of our development and of our health. I don't want to say that our health should depend on anybody but ourselves, even though I know that there are components to this health process. I've always said that medicine in America was built on the backs of African Americans, slaves who were used and experimented on, and not just in Tuskegee, but as slaves, as things, as chattel, as cadavers, and grave robbers would go and take them, or when the master saw that his plantation needed help, or that the slaves were sick, that's when they paid for medicine, but it was for the master and not for the slave. And now we are in this era that I think is, as you said, Robin, when the covers have been pulled off, we see that Black people with all the comorbidities that we have are adversely affected by this pandemic. And so I think it's important that we scrutinize and that we work. And I like your phrase in our video, Reverend Anderson, when you said we are family. So if we're going to change this, let's put the family together, all of us working together as a community to change this. And I think this is our opportunity, working with Yale and working with our churches and working with our vulnerable community. This is our great opportunity in history to make a change.
And Ray, just before I come to you, just want our listeners and viewers to know that we will be talking during this show about how the ambassadors have been part of this reconstruction process, if I can use that term, this rehealing process, and some interventions that the cultural ambassadors are involved with to kind of turn this history around. But Ray, I wondered if you had any comments as well.
Well, I do. There are a few things that were embedded in some of the comments that this other illustrious group of folks happened to mention. And the thing I'm focused on, I think Reverend Perry hit on it, is this self-awareness and self-care and how important that is. We can sit and talk about the millions of the perfect storm of things that have really worked against good health and wellness for Black and Brown Americans. However, when we peel through all of that, there are things that are under our own control. I know there's millions of reasons why people pick cigarettes up, but as Reverend Clayton pointed out, we know cigarette smoking is not a good thing. There isn't any systemic or cultural or anything that's really force that's really working our hand to pick that cigarette up and to smoke that cigarette. So when we take a community approach, I think it really allows us to work through self-care and self-awareness to educate ourselves so that we can have better conversations with our healthcare providers or seek them if we need them. A sad fact here, Tom, is that though we're one of the most advanced countries on the planet, American healthcare in general ranks very far down relative to other civilized countries, other, first-rate countries, supposedly. Mm-hmm. Now, within that, we've pointed out that the African-American community is even further down. Mm-hmm. So all the more reason, if you take an inadequate healthcare delivery system, and there's all kinds of reasons for it, it's all convoluted with who's making decisions about our health. Is it the insurance companies or the doctors, or is it the hospital? It's so convoluted here in America. All the more reason we have to have a community approach to support each other and educate each other to have good self-control of our own health direction.
Indeed. And we're going to spend the bulk of our time discussing community control, in particular under the auspices and the activities and the initiatives and the passions of the Yale cultural ambassadors, and particularly pertaining to participation in clinical trials. But before I do, just to kind of embed and to be consistent with the theme here about history, I just wondered, everyone, this idea of Sankofa, where you can look back, but center yourself in the moment, in the present, but also be innovative and creative in terms of the future. But how does the past guide us, perhaps, in terms? Are there any events, specifically in the past that we should not forget, and that are influencing our actions in the present? Are there any events from our history that stand out in your mind that we must not lose sight of?
I want to just say, let me just say this, and piggybacking on what Ray had said and what Clayton had said about cigarette smoking. It is systemic. I remember when Black communities were targeted with beer commercials and cigarette commercials. And when you take a people that's vulnerable, where the pressure is on them to feed their families, to live up to standards that were somehow, when the rug was pulled out from under them, the last hired and the first fired. I mean, we've now, and I think that taking charge of our health helps us to understand, that there is an economic thing behind this. And we've got to understand that big business makes money and hospitals is big business. And we've got to figure out a way how we can get down and sit at the table as partners to work out with them systems where people who have comorbidities and people who are vulnerable might be able to pay for their prescription medicine or get the care that they need that Robin is talking about in terms of access to health. And I think that's why this show is so important, because we ain't covering up anything. We really want to get the word out, and we want to get people involved to sit at the table so that decision-making is not just from the top, but it's from the bottom up as well.
So Reverend Perry, if I can, not to paraphrase what you're saying, but I believe you answered my question really in a specific way that I didn't even expect, about the advertising industry, the marketing industry, their past behavior being targeted in terms of exploiting us. So I appreciate your elaborating on that. Are there any other?
Tom, did you used to drink Coke 45 after you saw Billy D. Williams?
We only have 48 minutes, but if you want to take me, if you want to take me down the ripple and Coke 45 and Mad Dog 2020. I mean, but we won't go there. That's a different life before I got saved, right? That's it.
But also it shows that I agree with Dr. Perry said, that all of those commercials that are, will promote really bad health for us, really show that, in terms of some of the oppressive things that we're going through, how it would be a relief. And so I do think that in this big, like you said, it's just big industry in terms of they know who they were coercing to, and get to come and get involved. Just like we know that at one point there were liquor stores on every corner, or two of them on every corner, also certain cigarettes, how that would just make us feel cool and relieved, and all of those things. So, we do have to look at it, which is really, like we talked about, economics is so important. And I think there's some areas that we don't look at. All of this is somewhat economical, from slavery up until what we see today.
Before we go to
Tom,
go ahead.
Let me add to this great conversation we're having here. After Tuskegee, the ethical systems that were put in place after the outcry over that horrific event, it changed the regulation that the government now use for human research subjects. Governmental regulating bodies such as institutional review boards, the data and ethics monitoring committees, and the ethics courses were established to strengthen and help us so that these abuses will not continue. We have informed consent that and these are another thing that we can use to help us. And even when our people get involved in clinical research, there is what we call an opt-out clause. So no matter whenever you decide that you may not want to be a part of it, you can legally just get out. So as bad as things were, there are things in place now to not just help us, but to help all people so that some of the things of the past will not be repeated.
And this is a question for everyone, just kind of the tag team on what Reverend Clayton has mentioned. Let's spend some time on how the cultural ambassadors have been creating awareness in the African American community regarding the importance of participating in research and the importance of clinical trials. So, I'd love to hear from everyone, because we can spend some leisurely time on this topic, because this has been your strong suit, and I salute you for this ongoing commitment for more than a decade.
I mean, I would like to share that some of my greatest memories of being in New Haven, certainly working in the community there, the local community, was being able to visit some of the barbershops and beauty salons and just talking to folk about what we were doing. And for me, it wasn't the seniors that I think were most impacted. It was the young adults who, had this idea that I'm young and I'm okay, I'm feeling fine. I don't think I've got any issues. And then year or two later, they start developing problems or have friends that are developing problems. And they think about, that pastor did tell me about something that Yale was doing, or there's a diabetes study, or there was some information that was given. And hearing those kind of stories have had the greatest impact on me about the kind of work that we're able to do as cultural ambassadors.
We need you back.
Well, we have them here, and there's Black people that live in Georgia. I mean, rumor has it. That's what I've heard. I've heard that rumor, and most of us probably have relatives that we might not even know that live in
That's
Georgia
true.
now. Please let's hear from everybody about how have and will the cultural ambassadors continue to create and increase awareness, the importance of participating in research, and just in terms of just general knowledge about your body-mind health, body-mind-spirit connection.
Well, Tom, one of the things that the cultural ambassadors have been tasked to do is to do an assessment of disparities or disease that affect African Americans, and then to work with scientists from Yale and with the community to see how we can address those. So, I mean, before I was a cultural ambassador, I believe back in the day, the greatest thing that was affecting us was AIDS. And that was, so we sometimes get focused on one thing and we forget about the other thing. So what Yale has done is help us to not just look at one thing, but look at all of the things that might be affecting us, like diabetes or chronic heart failure or breast cancer. So when we pull them together and put them into our chart, we try to target at least one of those health disparities every month. We try to get doctors to come in and talk to us so that we can go back and talk to our people with clarity and with scientific data to help our community learn to develop methods of taking charge of their health. And so we've learned so much. I mean, the social determinants of health is something that we didn't really focus on. We didn't really focus on your zip code. It's like I was born in the ghetto, but I didn't know I was in the ghetto until somebody told me I lived in the ghetto. But now I understand that if you're in the ghetto, your insurance rates could be higher, your health access is lower. So there's a whole lot that we need to expose and bring to the surface, and to help people understand that it's an uphill battle. It's a fight that we all must get involved in it. But knowledge is going to help us to fight this battle. And this partnership and collaboration is going to help us to win the battle.
Reverend Clayton or Sam? Or
yes, sir. There were many posters and flyers. I heard Reverend Morrison talk about in the barbershops and beauty shops. We had certain stands with pictures and information on it in those places. shows like this. We now have commercials with children and adults, but the educational piece, constantly educating the community about their personal health, and we as ambassadors must also be examples. One great example of this, I went to my physician for my annual checkup, and he asked me, did I have a vaccination card? And I handed it to the nurse, and they came back and said, this is not valid. I said, what do you mean? He said, the vaccination was not available at this date. I said, I'm impressed that you caught that. I said, but I was part of the Corona-19 vaccine study. So that's why the date is as early as you stated. So it is valid. And so the doctor, he thanked me for being a part of the study, but he also was pleased that one of his patients was vaccinated before him. So the ambassadors are setting examples. Yeah, my colleague liked to boast that he's 2 numbers ahead of me on the vaccine, but that was because of my grace that he got to go first.
I think also too, to one of the greatest things also in terms of being a cultural ambassador that we have also really gained is that understanding clinical research and understanding it in a way in which we're able to teach it, to be able to educate persons in the community about clinical research and about how important it is and how they are included. They have every right to be a part of being able to be a part of studies that would address the health conditions that we have and getting state of the art medications and those kinds of things. And not only just that, but a kind of intergenerational piece. We have our young adult cultural ambassadors also, who are also being able to be taught. And then even this past summer, which was wonderful, we had high school students and younger students who also learned about clinical research. And so they are also able to explain clinical research to persons in the community. And also just being able to have experts that come who are in charge of different studies, to have conversations with them and understand the whole process of the study, but even to get firsthand information about various studies that we can bring to the community. And then each and every one of us, I think, has also had, even in our individual churches, in which not only just for churches, but also invited the community to come in to receive also information also about clinical research, about various health conditions that we all find ourselves in. And also, I think the other thing is teaching those persons that are doing studies to those things that are needed to be able to, get people to buy into those studies, especially people of color, and to get them to think about things that they had not thought about before. And so those are some of the things I think that, to me, that I resonate with, and just think that this project is so great.
And Ray, don't want to leave you out. I know we don't have the official clergy title, but it's, it's between you, and nor do I. So don't worry, you have backup.
Well, thank you, Tom. No, I want to just point out too, one of the other things the ambassadors have concentrated on is making the healthcare delivery system reflect the diversity of the population it's trying to serve. So we will point out, look, you need to get more researchers who are brown and Black, and we need to recruit more people into healthcare professions. Now, the beauty of it is, and I think one of the real examples that's makes me proud is the partnership. Yale is now on a aggressive hiring plan to try to broaden the diversity of its hirees. I I think through some of the things we did as ambassadors, some town halls, as you sit back and watch the pandemic unfold, I have seen more African American and brown doctors, immunologists, clinicians, and who did President Biden pick to head up the committee? It was Dr. Marcella.
Mm-hmm.
Example after example of African American and brown people's participation in the healthcare delivery system. And that's been one of the things we've really tried to do, is raise that awareness as ambassadors. The system has to look like the people it's trying to serve.
And before we move to any other, we have a few other topics and issues to possibly discuss, but I just wondered, are there any additional projects or initiatives that the ambassadors have involved with and or are proposing? Because again, a major focus of today's show is not just to lament the past, but to let people know that there's been ongoing struggle and certainly some successes, but also looking to manifest future successes. So are there any other projects or initiatives that you'd like to share? Because this is very important for people to know.
Tom, go ahead, Mark.
I was just going to say, it's not it is a specific initiative, and that is to broaden the conversation itself. And so I'm excited and have just been watching with amazement how this small group in New Haven continue this, not only across Connecticut, but we've got partners in North Carolina with Duke University, the Amy Zion Church there. We're expanding, of course, to Georgia and organizations and institutions here. So I think one of the things that YCCI has done very well is to lift this issue and the issues surrounding our health and wellness of people of color in this country to a national prominence. And it's just, it keeps growing.
Certainly scaling up, absolutely. Reverend Perry, you're about to say.
Oh, I think that what Morrison said, I just like to echo that. That's, you beat me to the punch.
Oh, well, it's worth repeating, because I don't think people understand that we all know, if we could count about 50 things that we've been involved with over our lifetime that are no longer around, that might have lasted a week, a year, 6 months. It's the difficulty of sustainability and sustainability and success, and kind of nurturing people, because we all know that community organization, people organization, just living and not dying is a struggle for some, if not all. So yeah, Reverend Perry, I mean, let's repeat exactly, if you want to say exactly what Reverend Morrison just said, but it's so important for people to understand that to keep hope, not only to keep hope alive, but to keep daily manifesting and providing evidence of that hope.
Yeah. So what Reverend Morrison was echoing, and even to another level, is that it was due to the success of the recruitment of the Yale ambassadors with regards to clinical studies that the FDA and many pharmaceutical companies and schools like Duke have looked at us to look at what we're doing here, because it has been so effective. And so we're saying that participation in clinical trials when we started was 3 and 4%. It went up to about 20%, some instances 30, some as high as 80 and 90. And we are still working to put together a blueprint, a template, a plan that will even enhance what we're doing now. So we have a study coming on alcoholism. We have studies now on depression. We have studies that are ongoing that we're going to work with the sickle cell. The director, the new director of the sickle cell here in New Haven, is working to look at teenagers and how psychologically it affects them in terms of their mental health. So we're ongoing, not just with the studies on the vaccine, but we're still looking at how we impact the lives of people, everyday people, seniors with Alzheimer's. We're doing something with that, with stroke victims. And so we're breaking up in teams, because there's so many people who are asking for us, so that each team can produce with that particular project, and then we can come together as a united body and continue the struggle.
Absolutely. Reverend Anderson, because I want to still, let's spend, we have about 10 more minutes on this. You have accomplished a lot, and I think people dismiss or forget, or sometimes just aren't aware. And we're human, we forget things, so we need to be reminded. Reverend Anderson, some of the successes and projects and initiatives that really resonate with you and that you're looking to be a part of for the future.
I think also Reverend Dr. Perry also mentioned several of them that we have. And also even autism is another project that we have. And then, also really, the project in terms of encouraging persons of color, Black students to also, be in the medical field, come into the clinical research field is some of the other projects that we are, continuing to work on as well. And, we're continuing to broaden at popular demand to expanding the cultural ambassador program. We have high demand of people that want to do it in their, other different universities and also, various areas as well. So, and I was thinking about also just in terms of some of the educational piece of it in terms of how we promote, clinical research also. And, just being able to continue to get the word out all over, in terms of our own station and different ways that we continue to come together. This Cultural Ambassador program, YCI has done a wonderful job and that it is continuing to expand. And I believe that even for the years to come, it will expand. And as you talked about longevity, we celebrated, about 10 years ago in our 11th or 12th year? Where, so just to let you know how this project has continued, and Cultural Ambassador Project has continued, and also has it continues how it continues to multiply also. And we have high demand for persons that not only just that, but also people that want to invest in the program and want to even take our model and use it other places.
Yes, use, and also let's be frank, steal and forget about the
origin. Trying to be nice,
She's nice. My job is just to try to bring it home. And again, because the human dynamic of theft, it kind of kicks in all around. And the fact that your brand you're continuing to burnish your brand, and it's a brand of integrity and transparency. That's the key for me, any successful business, nonprofit, church. Integrity, transparency is the key for you encourage that customer demand. Ray, any comments before we move to one or two other topics?
Yeah, just very quickly, Tom, a lot of the themes that are resonating on the comments that are being made is, the whole idea, the undercurrent of trust. Trust is like the most critical thing. But then upon that, you build health literacy. When you start to build health literacy, you get people who are willing to take and do better self-control. And then we translate into a phase where people are actually empowered. If you think about taking and getting into a clinical trial, what's that really all about? You're saying, look, there's a health situation that I have that I can participate in a trial and maybe make it better, not just for myself, but for other people. To me, that's just a great statement of self-care and empowerment. And that's really the undercurrent of a lot of the things we've been talking about.
We have about 10 more minutes, and I want to be sure that there might be some issues or concerns on your mind that we haven't covered. So I want to allow space for that. But I want to have a brief comment about the coordination, the collaboration, the partnership with Yale. I don't, here in New Haven and wherever you might be, there's going to be power structures, and as Reverend Perry's talked about, the systemic organization, but there are always going to be people that might have more quote unquote power than you might have. And so the fact that you've been able to be aligned and respected and influential within the Yale system, that cannot be stated enough. I would say 10 of the community meetings I might be on each week where people are bemoaning their ineffectiveness of being able to work with whatever XYZ power structure there might be. But the fact that you're integrated, assimilated, and then, but more than that, instrumental. So it's a spook that's sat behind the door. It's a clear investment. You're at the table, but also you're still stirring, and you haven't been kicked out yet. I think that's a key point I'm trying to stumble on. And you have not been kicked out, but in fact you've been building within the infrastructure. So let's share a few comments, if you would, whoever would like to, about your ability to be a part of this Yale monopoly to some degree.
May I just say, as we kind of segue into this, from day one, there have been opponents to YCCI and what we're doing with the Cultural Ambassadors Program. Been a whole lot. And I think most of us, if not all of us, have come up with this opposition one-on-one from either members of our congregation or members of our community, saying that you've bought into this Yale system, you're spewing out this misinformation that Yale is pumping into our communities. And when you peel that back, it is coming from a mistrust of the medical system itself. You've got generations of folk who, of course, fairly have, as people of color in this country, do not trust the medical system, but we don't have any other way. And something that Ray just said was that you've got to have health literacy. And that's what we've been doing. We haven't been telling anybody that you've got to take this medication or that medication, or you've got to see this doctor. We're saying, find out about your own health. Invest in your own wellness and find out the knowledge that you need to know about how you can protect your family or how you can care for your family members themselves. And this has been, I think, the strength of what we're doing. It is the health literacy piece. It is getting people encouraged and letting folk know that you've got these avenues around you and you need to utilize them for your family, just like others across the street are doing. You can do it yourself.
And Tom, very quickly, back to something I said earlier. It's almost a misconception, I think, in America that if you're white and you go into the medical care process, everything works perfectly. Yeah. It doesn't. White people have to fight just as hard to get the care they need, to have the doctors and nurses slow down enough to listen to them. Add on a person of color, and that becomes exponentially more difficult. So that's why literacy and self-empowerment and self-esteem, I deserve quality care and I'm going to get it. That's so important. And that is really one of the things we're trying to imbue in the community.
I would also add that the challenge is that most of white America knows the language and can get through the front door of the hospital. People of color don't know the language. And we certainly, when we go through the door, we're told, like, what are you doing here? So there's been a lot of things that I think the conversations and the work of YCCI with the cultural ambassadors have been able to do for folk of color in this country, or in New Haven and in other communities where we've been able to impact, that has really allow folk of color the comfort of being able to reach out to their doctor or to be involved in a clinical trial.
And I think also too, one of the things that we also, continue to do is that, not only are we bringing those messages and we, also engaging in health literacy, but we also invite them also to different sessions that they might hear firsthand and that they might have access also. I think YCCI does a wonderful job in, doing that, making sure that they also have access to medical professionals that they ordinarily would not have, and also researchers, so that they hear it, even from us, but they also hear it firsthand because they're invited to come and be a part of the various, sessions and programs and educational kinds of things as well. And I think that, that's one of the things to me. And then, I think that also that we've been able to bring back, even results of, clinical trials and everything, to the community as well, which also opens them up also to understand and know, how important it is and how they have access to this. these services.
And
And
let me
Excellent.
Go ahead.
and let me just say that you got to look back. So when we talk of YCCI, we got to remember Tim Howard,
Yeah.
and we definitely have to take note of Tisha Johnson Harris, because she is the driving force. This woman is a Black woman, and she is phenomenal. She keeps this program alive, and I mean, she's bringing in donors, and she is helping us to navigate some difficult waters. And then we have people like Ani Yema, who did the Pfizer research, and then we have Marcella Nunes-Smith, who is we mentioned earlier. So we have an impressive team. It's not like we're just dealing with a bunch of no-name people or folk who have not earned their bones in this field of science. And so working together with them, I'm honored to be a part of this team and to have you guys on this team, that all of us are part of this team, because I think due to that fact that we're on this team, we're going to make a monumental difference in healthcare in the country, not only in the New Haven area.
And Reverend Perry, since this is Black History Month and Black History Month show, just in terms of, you mentioned Tim Howard, was elder. Let's give it the proper, I know he's passed away, he's in transition, but he was the elder, he was the district.
Elder, he was Elder Tim Howard of the Hartford district.
And it's just, again, it's important to kind of to affirm his name during this show. We have 8 or 9 minutes. Anything that you think we may not have discussed or burning on your heart, or just as the Spirit is moving you to share before we
Tom. I just want to remind us of, prior to COVID, not only were we in North Carolina, in Georgia, and West New York, but we also did sessions in Puerto Rico. We were headed to London. We were invited to Washington State, and we spent some time in the nation's capital, all because of the work of Tisha and with the blessings of the dean. So the work was, if as much as you see now, it would have been even farther if COVID would not have hit.
But as you, and I don't want to put words in your mouth, Reverend Clayton, but are you also saying that I should book my bags and for the future? Or are we still get my passport ready? I'm hoping that's what you're.
You already have your passport. You're ready now.
Okay, good. Well, just let me know. Wheels up. That's the phrase. That's the phrase. Ray or Reverend Anderson, or just Reverend Morrison, any thoughts before we kind of conclude?
You were talking about I think it was a comment about the past and some of the things that we Sankofa thing, the whole thing.
Yes.
And one of the things that came to me was not something that was so much negative, but something that could be coupled with what we're offering in the modern medicine now, is that, when our people did not have access to healthcare, as Reverend Perry was talking about earlier, and the slave masters, they would bring in doctors for themselves after we saw this outbreak on plantations and all of that, was that our people had natural medicines, or we were concerned or looked at things around us. And that industry has grown even today. There's homeopathic medicines, all these things. But when you couple what our foreparents knew about the herbs and things around them with modern medicine, you've got a conversation, you've got an industry that looks at the health and wellness specifically of people of color in this country. And we've got to learn how to merge the two and have an emerging conversation with younger generations around that, how to take care of yourself naturally, coupled with what we know now of modern medicine.
And listen, before we go, let me just say this. In light of George Floyd, cultural ambassadors were asked to work with the dean on working out a new mission statement that would be more inclusive of people of color. And I think that's awesome. So her, Brian Smith, and Tisha, that's an important indictment on where we want to be in terms of where medical schools ought to be, schools that denied Blacks entry into medicine. So we had to do our own schools. We had to develop schools because we didn't have schools that would let us in. So we got Meharry and Fisk and Howard and Morehouse. Yeah. So not Fisk, but Morehouse, exactly. But that's that's where we've been. And so this has to change. And this is institutional racism, and it has to change. That we have to have a way of either developing our own schools or breaking down those barriers of 100 years of racism, institutional racism, that has denied Black people application into these schools. Just like they're trying to deny the Supreme Court justice that we want now on the bench.
And Reverend Perry, perhaps Dean Nancy Brown, the Dean of the Yale Medical School, perhaps we can chat with her on air at some point, perhaps her and Dr. Nunes as well, to see how the mission statement is now being implemented and enforced, just as an idea. We have about two more minutes, everyone. Just thoughts or concerns or issues or passions?
Well, Tom, just very quickly, they're citing that the healthcare industry is going to have a severe shortage of doctors and nurses and every other thing going forward. So it would not behoove us to sit here and not kind of reimagine how we need to move forward to be able to address that issue as African Americans and minority people. In other words, the slate's being kind of wiped clean. So we need to kind of figure out how can we get enough people into the professions to be sure that we have greater coverage, not less coverage, when we're seeing declining populations of people in the industry. So it's a challenge that we're going to have to face.
Indeed. Harry's going to play the music, so we'll know that that'll be the cue where the music will overwhelm our voices. So let's keep on talking until he does, but that's going to happen in about a minute or so.
Yeah, one of the things that I wanted to say, also under the direction, of Tisha and also all of the ambassadors, I think that we have really embarked upon really making this a family affair. And so, we're starting from we're not just adults talking, but we also have youth. And one of the beauties of, I think, the program that also happened during the summer is to address some of those things and getting people of color more interested in clinical research, as well as, in the medical field itself. Is that they, after they completed that program, they actually had various ways in which they were going to go back and be able to educate, other students. And I think that that's what we have to do. We have to start, and that's what we're doing. We're really working, starting with young people, and then, we're making it intergenerational.
Excellent. Everyone, thank you so much. We continue.
Lift every voice and sing till earth and heaven ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Lift every voice and sing till earth and heaven ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of a new day begun. Let us march on